High blood pressure, also known as hypertension, is a serious health concern that can lead to life-threatening complications if not managed properly. Fortunately, there are a variety of natural, at-home treatments that you can use to help keep your hypertension under control. In this video, we'll explore the top 5 hypertension treatments that you can do at home in order to manage and improve your overall health. 1. The DASH diet. Hypertension treatment doesn't always require a trip to the doctor or pharmacy. One natural remedy is the DASH dietary approach to stop hypertension diet. The DASH diet is an evidence-based eating plan that is designed to lower blood pressure, reduce cholesterol levels, and improve overall health. The DASH diet focuses on portion control and emphasizes fruits, vegetables, and low-fat dairy products. It also includes lean meats, fish, whole grains, and nuts. The DASH diet limits foods that are high in saturated fat, trans fat, cholesterol, sodium salt, and added sugars. In addition to helping control hypertension, following the DASH diet can also help reduce the risk of diabetes, heart disease, stroke, and some types of cancer. Eating healthy meals and snacks prepared with fresh ingredients is the best way to follow the DASH diet. Keeping track of food intake. By keeping a food diary can be helpful for making sure that you are getting all the nutrients needed for hypertension treatment. Exercise is another important component of hypertension treatment. Studies have shown that regular physical activity, such as walking 30 minutes each day, lowers blood pressure and reduces stress hormones. Additionally, getting enough sleep is essential for controlling blood pressure because it helps the body stay relaxed and regulated. Managing stress through relaxation techniques like yoga, deep breathing, and meditation can also help keep hypertension under control. Finally, reducing alcohol consumption is key for successful hypertension treatment. Alcohol has been linked to higher blood pressure levels, so limiting its intake can be beneficial for hypertension sufferers. To limit alcohol consumption. When it comes to treating hypertension, limiting alcohol consumption is a key part of the equation. Alcohol is known to cause an increase in blood pressure, making it one of the most important hypertension treatments. In fact, regularly consuming more than 2 drinks per day increases the risk of developing high blood pressure. That being said, you don't have to cut out alcohol completely to benefit from its hypertension treatment effects. Moderate alcohol intake, defined as 1 or 2 drinks per day, can actually reduce the risk of hypertension and the associated health risks. It is important to remember that drinking too much can have negative health consequences, so if you do choose to drink, make sure to monitor your consumption and keep it to a moderate level. Limiting alcohol consumption is a simple yet effective way to treat and prevent hypertension. But there are other natural home remedies that may be beneficial when it comes to reducing high blood pressure. One such remedy is diet modification. Eating a balanced diet with plenty of fruits, vegetables, whole grains, and low-fat dairy products has been linked to lower levels of hypertension. Reducing sodium intake can also help lower blood pressure levels. Aim for no more than 2,300 milligrams of sodium each day, and avoid processed and canned foods which are often loaded with salt. In addition to diet modification, regular exercise can be an effective hypertension treatment. Engaging in regular physical activity helps strengthen the heart, reducing strain on the body's cardiovascular system and lowering blood pressure levels. Finally, controlling stress levels through relaxation techniques, such as deep breathing exercises or yoga, can help manage hypertension symptoms and reduce episodes of anxiety-induced high blood pressure. 3. Reduce sodium intake. Reducing sodium intake is a key component of any hypertension treatment plan. High sodium levels can cause blood pressure to rise, so it is important to make sure you are consuming an appropriate amount. The American Heart Association recommends limiting your daily sodium intake to 2,300 milligrams or less, which is about 1 teaspoon of salt. In order to reduce your sodium intake, there are several steps you can take. First, opt for fresh produce and unprocessed foods when shopping for groceries. This means eating plenty of fruits, vegetables, whole grains, and lean proteins. Try to avoid processed and prepackaged foods that are usually high in sodium. When cooking, use herbs and spices instead of salt to season your food. Also, be sure to check the nutrition labels of foods you purchase for their sodium content. Lastly, limit your consumption of restaurant meals as these usually contain higher levels of sodium. By following these tips, you can help keep your sodium intake in check and improve your hypertension treatment plan. Other lifestyle changes to consider include exercising regularly and managing stress. Regular physical activity has been proven to lower blood pressure and reduce stress hormones. Furthermore, reducing stress through relaxation techniques such as yoga and meditation can also help control hypertension. If lifestyle changes do not suffice, medications may need to be prescribed by a doctor. Commonly prescribed medications include diuretics, ACE inhibitors, calcium channel blockers, beta blockers, and angiotensin receptor blockers. These medications have been shown to effectively lower blood pressure and manage hypertension symptoms. Ultimately, finding the right hypertension treatment requires an individual approach tailored to each patient's needs. It is important to talk to your doctor about what kind of treatment is best for you. They will be able to assess your overall health and advise you on lifestyle changes and medications that will work best for you. Additionally, adding supplements to your hypertension treatment plan may help support healthy blood pressure levels. For example, fish oil supplements rich in omega-3 fatty acids have been found to reduce inflammation and decrease triglyceride levels in people with hypertension. Coenzyme Q10 CoQ10 is another supplement that can provide cardiovascular benefits. Finally, monitoring your own blood pressure at home can provide valuable insight into how well your current hypertension treatment is working. For exercise regularly. Regular exercise is an important hypertension treatment and can help to lower your blood pressure. By engaging in physical activity, you can strengthen your heart and increase your overall health. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise per week. This could include walking, running, cycling, swimming, or any other form of exercise that increases your heart rate. You should also add strength training exercises to your routine, such as weightlifting and body weight exercises. Getting regular exercise can be beneficial not only for hypertension, but for other medical conditions as well. It's important to talk with your doctor about developing a safe exercise plan for you based on your age, level of fitness, and existing medical conditions. Additionally, making lifestyle changes, such as quitting smoking and eating a healthy diet, are recommended hypertension treatments. Cutting down on salt intake and increasing potassium can also help to reduce high blood pressure levels. Reducing stress levels is another effective way to control hypertension. Stress reduction methods, like yoga, mindfulness meditation, and deep breathing, can all be helpful in managing stress levels and improving overall health. Finally, some people find relief from hypertension with herbal supplements, like garlic, olive leaf extract, coenzyme Q10, fish oil, hawthorn berry, and flaxseed. Consult with your doctor before taking any dietary supplements. In addition to natural remedies, there are many medications available for hypertension treatment. These medications work by blocking hormones that cause blood vessels to constrict and increase blood pressure. Common types of medications used for hypertension treatment include angiotensin-converting enzyme-ACE inhibitors, calcium channel blockers, diuretics, beta blockers, and vasodilators. Some medications may have side effects, so it's important to follow your healthcare provider's instructions when starting a new medication. Making lifestyle changes may also be required along with prescribed medications, as they work together to reduce blood pressure levels. If lifestyle modifications alone don't sufficiently lower your blood pressure, consult with your doctor to find the right hypertension treatment options for you. 5. Manage stress levels. Managing stress levels is an essential hypertension treatment that should not be overlooked. Chronic stress can lead to a wide range of negative health outcomes, including hypertension, There are several methods you can use to manage stress levels at home. First, it's important to take some time for yourself each day to relax and unwind. Even if it's just 10 minutes, try to do something that you find calming or enjoyable. This could include activities like listening to music, reading a book, taking a warm bath, or meditating. In addition to taking time for yourself, make sure to get enough quality sleep each night. Post-sleep quality and lack of sleep can lead to increased stress levels. Aim for 7 to 9 hours of sleep each night, and try to keep your sleep schedule consistent from night to night. Finally, try engaging in some form of physical activity each day. Exercise is a great way to manage stress levels, because it releases endorphins that can help improve mood and reduce stress hormones. Whether it's a short walk around the block or a more intense workout, make sure you find something that you enjoy and that works for your lifestyle. Thanks for watching, and if you enjoyed this video, be sure to give it a thumbs up and leave a comment below.